Road crashes or road traffic accidents are significant challenges, mostly exacerbated by heavy traffic, road topography, brake failure, overloading, overspeeding, and flouting, other road traffic rules. This is in most cases is preventable, and one would ask how. However, whether it is a road accident or heart attack, crisis can strike anyone, anywhere. But how we respond in those critical moments can make the difference. Says an ambulance system. It's a pleasure to have you in Nigeria today.
Thank you.
Now, let's begin with you, Felix. Let's start with the recent accident involving Anthony Joshua, and of course the one that involved our staff, And if you look at both accidents, they were attributed to overspeeding, reckless driving. So why do we keep having situations as this?
Well, as everybody knows, the FRSC, right from inception, these are some of the things that we have always campaigned against, especially when it comes to the manner in which we drive those vehicles. No matter how bad the road condition is, the most important thing for drivers, especially out there on our roads, you have a responsibility to adjust your driving, to adjust your speed to suit the prevailing situation. So no matter what that obtains there, whether it is in the vehicle, whether it is the road environment, whatever it is, the human factor is one of the most important and the most critical aspects of whatever situation that you find yourself. And the two incidents that you made reference to are really, really sad, and we express our condolences to the families that are affected by the two crashes, the ones that we're talking about. But speeding, everybody knows, actually contributes to the severity of the crash. No matter how you look at it, no matter what factors that you want to put out there, but once speed is involved, you must definitely be sure that that crash will definitely, whatever the injuries that are there, will definitely be exacerbated by the speed at which the vehicle was traveling at that moment. And if it also involves other vehicles coming into it, or even the road conditions being bad, if there's a tire burst, whatever it is, speed contributes to it. So, and that is what our campaign has always been, that you must maintain your speed, you must maintain your vehicle, you must drive at your comfort, you must not allow yourself to be distracted while driving, so that all those conditions, by the time you put them together, they actually contribute to what we are talking about. So that has always been the theme of our campaign. People must drive their vehicles in such a manner that your safety is not compromised.
Thank you very much, Felix. Now to you, Dr. Dobra. We've seen situations where, accidents happen, and instead of, us to be human by trying to, help in the situation, we see people using their phones, trying to create, I don't know what they really call it, creating content, creating content with, those kind of tragic situations. I mean, how can we, go beyond creating content and saving lives?
Oh, thank you very much. And like my colleague has said, condolence to the families that lost Anthony Joshua, the NTA management and staff, as well as other emergencies that have resulted in loss of life. There's something I said, let's focus on lives and not likes. You don't need to trend on all topics. Now, NEMSAS as a program has been established by the federal government, as you said, to operationalize the emergency medical treatment gateway of the Base Healthcare Provision Fund, which is at least 1% of the Consolidated Revenue Fund. Now, what this means is the federal government has made funding available to manage emergency medical treatment. The NEMSAS program, through the National Emergency Medical Treatment Committee, has an existing memorandum of understanding with the Federal Road Safety for highway emergencies where we deploy the Zebra ambulances. And I know presently the Federal Road Safety are implementing the Operation Zero program. And I want to commend them for being first responders. To correct a general notion about NEMSAS, NEMSAS are not custodians of the 112 emergency communication number. that is under the purview of the Nigerian Communication Commission.
Yeah.
And the entry point to any emergency is communication. Our response agencies are not clairvoyants. We're not magicians. We cannot sense an emergency when it happens. Now, these people that take these videos and try to create content still pass these ambulances on the way and not notify them. They could have well called the 112. Now, there's another notion that people are not aware of the 112 number. But you can't see out of a number of people that passed that accident, nobody knew that we could test this number. And you know, in some states, we say the number is not that functional. But let's try it. And I want to use this medium to also encourage the NCC to improve functionality of this number, because without having access to an effective emergency communication number, we'll continue to lose lives. This is why under the State Emergency Medical Service and Ambulance System, most of them have created their own alternate numbers. Now, in a country, you can't have multiple emergency communication numbers. You can't start memorizing the emergency communication number from state to state on a journey. It's not efficient. And what happens in most cases, the Federal Road Safety are always the first at the scene. The responsibility of the ECC is to ensure that you triage these emergencies and deploy the appropriate emergency agencies to the scene. Like you see that accident, you have required the fire service to be there to help bend those ions to remove the people. And as a general statement, we all have to be trained on basic life support. We made a commitment to the Corps Marshal that NEMSAS will be training all Zebra ambulance drivers and operators. And I think as a final statement, let's focus on lives and not likes.
Definitely will not be your final statement, because we still want you to say more.
Thank you. Sorry.
So now back to you, Felix.
Yeah.
You know, we are in the Christmas season. There's heavy
Yeah.
travels, heavy traffic. Now, how can our drivers, both commercial and private car owners, drive to stay alive?
Well, driving to save our life is very easy. And as part of our focus for this Ember season, we started with a media outing where we engaged the stakeholders. We discussed extensively, engaging all our stakeholders. And apart from the town hall meetings that we had with the press briefings that we had, we also visited motor parks. These are places where we know that a large number of people are actually patronizing to make their travels easy. And in those places, we focus on commercial drivers, because we know that they take the chunk of travelers, especially during this season. And our reaching out to them has always been on the need to ensure that, number one, those vehicles are well maintained, at least up to minimum safety standards, to ensure that at least you can travel from point A to point B without having issues on your way. And apart from that, like I said earlier, no matter how sound your vehicle is, no matter how bad the road is, the main thing revolves around the person that is driving that vehicle. A lot of us in Nigeria, we pray a lot. But I said there are a lot of things that we need not to pray about. What we need to do is to act. Take action. You don't need to pray not to speed. You don't need to pray to buy tire. You don't need to pray to ensure not to overload your vehicle. You don't need to pray to do certain things. The most important, those things that you already have control over. You have control over your speed. You have control over how you use your phone. You have control over how you load your vehicle. You have control over how you manipulate your vehicle, even within the kind of conflict that we see, particularly during this period. Because we know that once the traffic is high, particularly during periods like this, conflicts are also very high in terms of the categorization of the kinds of people that you find on the road out there. You have the private drivers, and I always even say that during this peak period, we also have instances where people that have not traveled for a very long time with their vehicles, perhaps they have not even exposed those vehicles to long travels.
Long distance, yes.
Yes, you've been using it in Abuja maybe for the past 1 year. You have not even traveled up to Kefi. So you have not really tested whether that vehicle can afford to travel like from here to Lagos. Maybe by getting to a local, they discover the car is overheating. And so many other circumstances like that. So for those that are private car owners, and we have always insisted that it's not compulsory that everybody must travel. If you are 10 in your family, must all the 10 of you travel? And we have even also said, this one might, of course, might just be a cultural issue. A lot of times when people are traveling for this kind of season, you want to carry goats, you want to carry sheep, You want to instead of you, of course, why not just package the meat, put it inside a box and travel? But a lot of us want to carry that goat physically,
goat, yes,
so that they will see it.
So that they will see that you
you have slaughtered a goat.
You're working hard.
You're working hard. And even the cattle that we carry all over the place, why can't we find place where we can even process the meat? If we are to process the meat, for instance, to travel to carry to Lagos or carry to Port Harcourt, we won't have the stress of carrying animals all over the place. That would have been easier, and we can also lessen the kind of issues that we have on our roads. For private car owners, most of the time, you don't have a park where you really meet them to talk to them about some of these issues. We target worship centers, churches, mosques, and all that. By the time you visit up to 10 churches, you know that perhaps you must have reached out to maybe 2,000, 3,000, and bring up these same issues that we're talking about. Speed, speed, speed. Wrongful overtaking, use of phone while driving, distracted driving, fatigue. A lot of times people don't even take enough rest. And for commercial drivers at this period, because you want to make as many trips as possible, because the passengers are there for you to carry.
Okay, now back to you, Dr. Dobra. Of course, we've had quite a lot of don'ts that the FRSC is saying. Don't do this, don't do that. But then again, when it happens, of course, that is when you are called, when it happens, when the situations are on ground. You rightly mentioned there's a number they will call. So how effective is this agency? I'm talking about the emergency medical services. The responders, how effective are they?
So to look at the organogram, firstly, NEMSAS is not an agency. It's a program under the Office of the Coordinating Minister of Health and Social, Professor Mohammed Ali Pate, who has led us from where we were to where we are now, making sure that we have sustainable fund disbursements to provide funding for emergency medical services. And also is aimed at increasing the global spread, the national spread of ambulances. So he wants equitable spread of ambulances in the country, because the standard is 1 ambulance to 50,000. So you can imagine how many ambulances we need. Now, NEMSAS don't procure ambulances. We are short payers for ambulance trips, be it from public sector or from private sector. Once you are onboarded by our subnational programs or agencies, so in some states it's an agency, like Lagos, Las Ambos, established in 2001, is an agency. Ogun SEMSAS is an agency established in 2011. So some of these agencies were established before we had a national body to provide standards and protocols for emergency medical service treatment. That is pre-hospital. What's the standard of human resource you need in a basic life support ambulance? What are the equipments you need? What are the medications you need? In an advanced life support ambulance, what are the human resource? Same thing. So we set standards and we are setting protocols, and also serving as mediators to ensure that we bring private sector into the ecosystem of EMS. The government can't procure all the ambulances, be it state. We need to bring in the private sector. The private sector provides about 60 to 70% of health service delivery in the country. So we can't focus on the public sector that's bringing 30%. We must surely collaborate with the private sector. And for that, the coordinating minister had directed that we engage, and we are at an advanced level of engagement. We are at the final level of reviewing how this partnership will go on. NEMSAS in January 1st is going into digitalization, because one of the main factors that delayed our integration to the private sector is digitalization.
Okay, you tell us more about that.
Okay,
after the break. We'll take a breather here. This conversation will continue shortly. Don't go away.
Thank you very much.
The implementation of the ruling is also dependent on another aspect or another arm of government.
Nowhere in the world will allow, under digital economy, for banks not to be dispensing domestic currency in that economy.
What will make this one different? We want to know what they do as occupation. All of these are attributes that are questions have been designed to investigate.
In a few days to come, you see that we are all around their own crannies and everywhere in Nigeria, telling people to cooperate.
Welcome to Nigeria Today.
Welcome back. This is in Nigeria Today. We're talking about accidents and emergency medical services. And of course, I have two gentlemen here in the studio for this conversation. Now, back to you, Felix. Quite a lot of accidents we've been recording just between yesterday.
Yeah.
You know, a few days and yesterday, we've seen quite a lot of accidents here and there. Okay. How can we, as Nigerians, maybe as passengers, as pedestrians, work, or what is our role in preventing these accidents?
Yeah. Well, accident prevention requires a lot of things, and we have always said that safety is not the responsibility of one person. Safety is not also somebody that is sitting down alone out there and asking people to do certain things. Everybody has a role to play. For commercial vehicles, for instance, let me just give an example with that. We know that commercial vehicles carry passengers. And the passengers, that is why the theme for this year's Operation Zero and the Ember Month campaign that the FRSA flagged off, take responsibility of your safety, avoid distracted driving. Because we believe that distracted driving can also be a very huge cause of so many accidents. And if we can also exclude that in the manner in which we drive our vehicles, it will go a long way in reducing the number of crashes that we have. So, and that team is carefully selected because it also involves the passenger. So that means if you are a passenger in a vehicle, you are not expected to sit down idly there, even when you know that your safety is being compromised by the manner in which the driver is driving that vehicle. Assuming he is playing with his phone, and you are seated there as a passenger, are you supposed to keep quiet and watch? You are not expected to keep quiet and watch. You are supposed to speak out. So you are taking responsibility by speaking out. If, for instance, you discover that your driver is fatigued, he's literally tired, and you can really sense that, you're also expected to speak out and say, no, you cannot do this.
So what can be done when he's fatigued? You see that he's tired, sometimes they're even sleepy.
Yes, he should take a rest, because the National Road Traffic Regulation requires that if a driver drives for like 4 hours, you're expected to take a rest for like 30 minutes. For organized transport companies, for instance, we've been able to carry that to a level by ensuring that the responsibilities of the safety manager, the responsibility of the driver, and the responsibility of the management of the company, the transport company, are all incorporated into what we call a document.
Maybe you should take that again. You said after every 4 hours, the driver is supposed to rest.
Yes, at least minimum of 30
minutes.
Yes,
okay.
Minimum of 30 minutes after driving for like 4 hours. But a lot of times, because of this season that we are now, you discover that people are not even ready to wait. And a lot of times, too, you discover that it's the passengers that are even insisting that even the 10 minutes rest that we are supposed to have, some passengers are so much in a hurry that they don't want to take that little time to rest.
They want to get to their destination
as fast as possible. Want to get to their destination instead of making your arrangement early enough so they can move and create time for you to rest. The vehicle is not being driven by anything. It's by a human being, and he needs that time to rest. So we need that. And apart from that, as passengers too, if you discover that the way and manner the vehicle is being loaded, even right in the park, you have right to speak out. I have had instances where some people will say, if it is this vehicle, I won't join it. So we have instances where a lot of our passengers are just docile, they don't want to speak, or even where the vehicle is dangerously overloaded, you are even trying to create a situation whereby you can either educate or discipline the driver. You have some passengers even ready to drop from the vehicle and trek ahead of the vehicle so that they can pass their place and join the same vehicle.
Talking about, raising an alarm, maybe when you see the vehicles being overloaded.
Yes.
Remember, you must have paid before all that. And they will not refund you. No,
you definitely get your phone back.
Okay, who will facilitate that?
You. Because our passengers have been very passive a lot of times. So that is why even those that are doing the loading in the parks take us for granted. They take passengers for granted because you don't insist on your rights. Okay. You have a right.
Okay, I'll have to stop you there, Felix, so that Dr. Dobra can talk to us. Now,
Okay.
you're talking about the collaboration, private sector collaboration.
Yeah.
Now, what areas do you think the private sector can come in here? You know, and what role do you think they can play here?
We highly need the private sector for ambulance coverage. Like I say, in Nigeria, we need about 4,500 ambulances for equitable spread of ambulances. So we need private sector to fill in that gap. Presently, we are about 500 to 600. So we see we have a huge gap, with Lagos having the highest. The Federal Road Safety has contributed about 150 Zebra ambulances to this fold of ambulances. So we really need the private sector to come in bringing more ambulances. We agree on the pricing regime, which we are presently negotiating on, to make sure we have ambulances across our country. Secondly, the areas of in-hospital stabilization, we also need private sector treatment facilities to kick in. So we have at least a treatment facility closest to any scene. We don't have to travel a long distance to transport a patient, because you know time is important to have time to be considered when it comes to emergency.
Time is of the essence when it comes to emergency cases.
So also in digitalization to help, because with the competition brings improvement in everything. The private sector comes with their own competition with the public sector. As NEMSAS will play an agnostic role. We are not operators. We have no ambulance. We are just payers.
Okay, now, before you come into the scene, like in the case of an emergency, in the case of an accident, what can anyone do in that circumstance? Like you see people bleeding, what should they do?
I think you first need to call for help. In the beginning of any emergency, you need to call for help. Firstly, literally call for help. Get people to come around. But if you don't have the requisite skill to manage that patient, don't touch that patient. That issue of pouring water on the patient when you feel the patient can actually exacerbate some other comorbidities. But actually call for help. Call the 112 number, right? Irrespective of the doubt if it's working or well, let's try. Then also we need to be observant. Some states, I have some numbers I'm still going to broadcast. Some states have their own alternate emergency communication number.
You can say it now.
Yeah, they're long 11-digit numbers.
Okay.
And that is why it's not appropriate to have that long number, because it's not easily collectible.
Just
now we have the
122.
122. We have the 122 for Federal Road Safety.
122?
122.
Yeah.
We have the 112, which is the emergency communication number. We are not custodians of that number.
Okay.
We are response entities like the Federal Road Safety. Okay. We handle medical emergencies. Lagos has 767. So these are alternate numbers you can use to key into the emergency system. So thank you very much.
Thank you very much, Dr. Emurin Dobraise, National Program Manager, National Emergency Medical Services and Ambulance System. Thank you so much for coming on the program. And we also have Felix Feman, FCT Sector Commander, FRSC. Thank you so much for coming.
Well, thank you for having me. Thank you so much.
And thank you for being part of the program. I am your carrier, Clinton. Goodbye.
Thank you.